Do you suffer from shortness of breath? How about leg swelling? Think your persistent cough is just a viral infection? You may want to think twice. If you suffer from these issues or others we were about to show you, you may be suffering from left ventricular systolic dysfunction. Symptoms include tiredness, faster irregular heartbeat, dizziness, confusion, increased nighttime urination, nausea, or lack of appetite.
Hi, I'm Dr. Tardy. I'm not a real doctor, but I will be playing one in this video. I'm here to talk to you about heart health and encourage you to be a friend to your heart by making sure it's functioning properly.
But how? How can I find out if my heart is healthy?
Simple. If you suspect your heart is suffering from myocardial dysfunction, then you should talk to your doctor about getting an echocardiogram.
Does it hurt? I don't like going to clinic so I can get poked with all kinds of needles and such.
No, it doesn't hurt at all.
We use a transducer just like this one to send sound waves through the patient's chest cavity to pull up images of their heart. While other methods used to evaluate your heart may require the use of harmful radiation, potentially dangerous reactions to medications or dyes, or claustrophobic conditions, echocardiograms are very safe and non-invasive, not to mention less expensive.
I got money in the bank. Yeah. Shout out what you drink. I got money in the bank. Yeah. Shout out what you drink.
Hey, what was that nurse looking for?
Actually, we're not nurses, we're echocardiographers, also known as sonographers, and we have a variety of tools to help diagnose the systolic function of your heart. Let me explain it to you. Before your echocardiogram begins, your sonographer will attach a series of electrodes to your chest to evaluate your heart rate and rhythm. A healthy heart rate is about 50 to 90 beats per minute. That should leave enough time for your left ventricle to fill with blood so that enough oxygen is getting circulated throughout your body to feed your organs. But just because your heart rate is in the normal range, that doesn't mean your heart is healthy. It's also important to make sure that all the muscle segments in your left ventricle are squeezing effectively and coordinating as a team in order to force that blood into your systemic circulation.
What? Muscle segments? I don't get it.
You see, although you may think of the heart as one big muscle that either squeezes or doesn't, the left ventricle is actually composed of 17 different muscle segments, and all of those segments need to be healthy in order for your heart to pump effectively.
How do you break a muscle segment?
Well, myocardial fibers can be damaged from conditions such as hypertension, coronary heart disease, or myocardial infarction. If a portion of your left ventricle is damaged, an echocardiographic assessment will help diagnose the level of dysfunction. It's possible to see muscle segments contract slower and with reduced thickening of the muscle, or show completely no motion whatsoever. Portions of the ventricle may even be too thick or squeeze in the wrong direction. Ventricular wall motion will be scored on an index of 1 to 4 as shown on the following chart.
Preload and afterload conditions are also important factors to consider when assessing ventricular function. What are preload and afterload, you ask?
I didn't ask that, and I really don't care.
Good question.
Preload has to do with how well your cardiac cells stretch before contraction. If there is an overload of blood volume in your ventricle at the end of diastole, it may eventually overstretch and no longer squeeze effectively. An excessively high preload can lead to cardiac failure. Afterload is the load against which the heart must contract to eject blood all throughout the body. If there is any arterial stiffening or excessive aortic pressure, your heart is having to work too hard.
How do you know if my heart's working too hard? Do you just look at the screen and guess at its function? No, we never use the eyeball method.
Instead, The doctor will evaluate the systolic function of your heart by our calculation of the following very important ejection phase indexes.
The first index is ejection fraction, which is the percentage of left ventricular diastolic volume that is ejected with systole. Make sure you ask your sonographer if they're using Simpson's biplane method of discs, as that's the most accurate assessment. Also, keep your eye out to ensure they calculate using both apical 2 and 4-chamber views. Rest assured, if you come to the ACC clinic, you'll be getting scanned by students who have been instructed by the best of the best. If a sonographer is using one of the following methods, such as area length method, or worse, M mode of the LV, run, as they are potentially diagnosing you with a pathology that doesn't exist.
It's also important to note that just because you present with normal ejection fraction values, that doesn't exclude you from potential pathology. There could be things such as mitral regurgitation, meaning reverse blood flow between left heart chambers during systole. With severe mitral regurgitation, your cardiac output could be significantly reduced because instead of that blood being ejected throughout the body, a significant amount of blood volume is leaking back into your left atria.
Oh my gosh! If I have this mitral regurgitation, does that mean I'm going to have heart failure? Also, am I supposed to know what cardiac output means? This is all so confusing, and I don't want to die!
First of all, cardiac output is the amount of blood the heart pumps in 1 minute, and as stated earlier, it is dependent upon your heart rate, contractility, preload, and afterload. Secondly, if you suspect you are suffering from a mitral regurgitation, you should definitely get an echo assessment. The good news is, if you do have a significant mitral regurgitation, it will be easy to assess the amount of dysfunction using Doppler methods, which we will discuss later in this video. Another index commonly used to assess systolic function is fractional shortening, which determines the change in the LV cavity dimension as the relaxed ventricle begins to contract with systole. The mean velocity of circumferential fiber shortening, or mean VCF, is also calculated, which is really just a measure of how quickly your ventricle squeezes. This index essentially evaluates how well your myocardial cells are contracting together. Echocardiographers will further evaluate the function of your ventricle using really dope Doppler waves such as the one appearing on the screen before your very eyes. These badass waves can help the sonographer determine the health of your ventricle using calculations such as change in pressure over change in time, the Tay index, and systolic time intervals. Systole is made up of 3 phases. Pre-ejection period, or PEP, is the first phase and is marked by the interval from the onset of ventricular depolarization to the beginning of aortic ejection of blood. The rapid ejection and reduced ejection phases together make up the left ventricular ejection time, or LVET. The ejection time interval is represented by the beginning to cessation of aortic flow. The ratio of pre-ejection time to the LV ejection time can also be calculated in order to further assess the function of the left ventricle. Notice the quick pre-ejection period on patient A with the healthy heart. The diseased heart on patient B reflects a long pre-ejection period with a short left ventricular ejection time.
The Tay, or Myocardial Performance Index, is a measurement of systolic as well as diastolic function, because it takes the whole cardiac cycle into consideration. The isovolumic resting and contracting periods are looked at in relation to ventricular ejection time. A prolonged pre-ejection period, or IVCT, fast left ventricular ejection time, along with a decreased ejection fraction, are red flags for coexisting systolic and diastolic function. And as all good sonographers know, if you have systolic dysfunction, you already have diastolic dysfunction. Let's talk about change in pressure over change in time, also known as dP over dt. This is one of those measurements where a mitral regurgitation is needed. Your sonographer will record the velocity of your regurgitation using continuous wave Doppler. Then, by using the simplified Bernoulli equation, the velocity can be converted to pressure, and if your ventricle is contracting normally, a rise in pressure during the isovolumic contraction phase should happen very rapidly. An increase in the time it takes to generate pressure is a signal that your ventricle is sick. Don't worry about memorizing this formula. Your sonographers have it memorized. And if they don't, just know they definitely didn't graduate from the outstanding ACC Echo program.
As was stated earlier, an increase in preload volume can be harmful to the function of your heart. Hopefully, your ventricle is shaped like the elongated one on the left in this image, opposed to the extremely spherical ventricle on the right, because the ball is not in that person's court due to their heart pumping inefficiently.
Believe it or not, cardiovascular disease stomps out more lives than all forms of cancer combined. 1 in every 4 deaths in the United States is due to heart disease, which is roughly about 600,000 people annually. In the U.S., it is currently estimated that 5.5 million adults have heart failure, and that number is expected to rise to 10 million by the year 2040. Coronary artery disease is the leading cause of heart failure. Also known by the name of atherosclerosis, coronary heart disease is a narrowing and eventual blockage of the arteries that feed the heart. Plaque and cholesterol buildup block sufficient blood flow, leading to a decreased oxygen supply to the myocardium. Hypertension significantly increases the risk of developing coronary artery disease, so much so that they are believed to go hand in hand. If the myocardium is deprived of oxygen for too long, necrosis of the myocardium quickly develops, leading to a heart attack. Survivors of a heart attack may have permanent muscle cell death, which can further cause wall motion abnormalities referred to earlier. These abnormalities lead to systolic dysfunction, which eventually ends in heart failure.
Although family history and genetic factors play a role in the risk of developing coronary artery disease, the following are risk factors that are in your control. Smoking, excessive body weight, especially around the waist, high cholesterol, high blood pressure,
It's about diabetes.
lack of regular exercise, excessive stress levels, depression, excessive alcohol consumption. And just remember, heart attacks are irreversible, so take care of your heart every day.
For real though, if you want to get your heart checked out, come see us at the ACC Sonography Lab in Round Rock, where you can exchange 1 hour of your life for an absolutely non-diagnostic echocardiogram for free.
Absolutely free.
No charge.
Don't worry, your sonographer will handle the transducer safely, but you may want to watch out for our state-of-the-art stiff beds. They may leave you bruised if you lie in the left lateral decubitus position for too long.
Goodbye now.